Let's do a quick check on your health. We've talked about the health of Osun State, right? Yeah, but we're not leaving you out. And we just want to have a quick conversation about your health because we understand that for you to be productive, for you to be effective and efficient, your health has to be the very best. But there's been this very silent killer, some have described it, self-medication. It's very silent. It's just those things you do here and there. You have a little headache, you have a little pain, or you have a so-called malaria, and people just go out there, get medication. And you see the pharmacies sometimes also just give you some of these medications. Some others have to be prescribed by doctors, but more often than not, you have people still self-medicating. What are the dangers? This is going to serve as a reminder yet again of the dangers around self-medication. We're joined by General Practitioner from Birmingham, United Kingdom, Dr. Essien Okoribi, joining us virtually today. Good morning, Dr. Okoribi. Welcome to the Morning Brief.
Good morning. Thank you for having me.
I know that there is a stark difference between what obtains there and what obtains here. For example, with antibiotics, right? I know that medications, you can't just go to the pharmacy or to the chemist and just get off the counter. It has to be prescribed. Some people can get a balance. For some people, they say, well, that slows down the process of medication there. But some say, well, it safeguards the health of a patient, ensures that you don't abuse these drugs. So I know that you have an understanding of both claims. How do you marry them together to get the very best practice?
Right. I mean, when it comes to self-medicating, you're absolutely right. In different locations and parts of the world, different things are obtainable. So, for example, in countries in Europe or America, for example, you cannot get some types of medications over the counter, as we call it, or without a doctor's prescription. But then there are some certain medications that you can get over the counter. So your simple pain relief like paracetamol, ibuprofen, and things like that, you can get those without a doctor's prescription. And one of the reasons that is done is because they are trying to make patients take responsibility for their health. And of course, if you then have something more serious, you would need to speak to either your general practitioner or your doctor to get advice on what kind of medications to take. Now, this is slightly different back home in Nigeria, where you can get almost anything over the counter from the chemist or from the pharmacy. You can get antibiotics, you can get pain relief, you can get diabetic medication, you can get everything without a doctor's prescription. All you need to do is to know the name of the medication. So this becomes a challenge because people then take decisions into their hands to make diagnosis for themselves following a number of symptoms that they experience, and they can walk up to the pharmacy based on that diagnosis that they have made, get medication, and then start treating themselves. So they don't know, one, if the diagnosis is correct, because they are then stepping into more complex territory. So we've left the simple headache or the simple migraines, the simple joint pains, to maybe things like feeling generally tired, having chest pain, having abdominal pain, especially if this problem becomes a recurrent problem. They then move to making their own diagnosis and, of course, going to the pharmacy, getting medications for themselves and start treating themselves. And that's where self-medication comes into play, which is essentially taking medication to treat ailments without prescription or without professional guidance.
So in your view, what do you think makes people resort to self-medication? Is it inability to access quality health care, or just the concern that if I get to the hospital, I don't want to find out what I'm afraid of? Or what exactly? There should be a reason, a driving force as far as that issue is concerned. What in your practice have you found out this to be?
Absolutely. Again, it's different for different climates and different locations. So when I practiced in Nigeria, it was clear that people would rather present late to healthcare facilities for different reasons, which includes the cost of consulting a doctor, the monies that you would have to pay for medication in a hospital, as opposed to what you would get simply from going to the pharmacy. And like you rightly said also, some people are not just bothered about their health. Some other people are afraid to find out that there's something even more serious, wrong with them. So they'll rather do it themselves and manage their problems themselves. And so the health-seeking behavior in Nigeria is below average. So most people, a study done, across the 6 geopolitical zones in Nigeria a few years ago showed that at least 70% of people would choose to manage their health problems themselves, as opposed to consulting a doctor. So they would self-medicate first before they approach a doctor. And of course, cost is a big factor. This is completely different in a country like the United Kingdom, where I currently practice, where at the slightest symptom, patients will be at your door knocking, seeking for a consultation. Yes, health system in a country like this, or health care in a country like this, is completely free. So whether that's abused or not, or whether patients are using it, irresponsibly, that's a different matter at all. But with the slightest symptom, you have patients seeking your advice. So I think cost is a very big issue. I think access to healthcare is also a very big issue, and also lack of education as well, which is why talks like this are very important. People don't know that if you've got problems with your health, you should not take responsibility into your hands. You should seek professional advice.
So when do you seek professional advice, or when do you go to the surgery? I know in the UK, surgery also means a physician's, office. It also means, I think, a meeting with a member of parliament. I don't want to get into that confusion this morning. But when should you visit your physician? So you feel a headache, you can self-medicate then, maybe. Or you feel some other symptoms, can you self-medicate? When should you really visit, so people know what to do when they feel what?
Right. So WHO talks about responsible self-medicating, which is essentially, taking medications to treat yourself for short duration, for simple ailments, according to what that prescription has, or that medication has been made for, which is safe and effective. So to answer your question, when you have a simple ailment, which is of a short duration, for example, I've had a headache for the last 2 days and I've taken some paracetamol, or I can take some paracetamol at that point. I've had a headache for a few days, I can take some ibuprofen. I've been at work all day, and my back is hurting for the first time, first couple of days, I can take some pain medication. My knee is hurting because I went to play ball, I can rub some ibuprofen gel on it. Now, there's something that we normally see on television when most over-the-counter medications are advertised. They say if symptoms persist, consult your doctor. So firstly, when simple ailments persist, when simple ailments become chronic, it's an indication to consult your doctor. When you feel generally unwell in yourself, so you're unable to carry out your normal day-to-day activity, you cannot go to work, you cannot do the normal household chores that you would do, that's gone from simple to more complex. That's an indication to consult your doctor. When you have a chronic health problem, so things like hypertension, diabetes, you've had a heart attack previously, so any chronic problem that you have is an indication for you to regularly consult your doctor, because those are not problems that you should handle by yourself.
There you go. We've not even touched on some people who don't even consider doctors. They go to their herbs. That's where they self-medicate. But we're totally out of time. We just wanted to raise this conversation yet again for people out there. We've been speaking with Dr. Essien Okorobi, general practitioner from Birmingham, UK. Thank you for your time. Wish you the very best today, whether you're going to surgery or what have you. All the best.
Thank you.